Ashley's going to start now.
Okay.
Okay. So welcome everyone to the Canadian Nurses Association's webinar series, Progress in Practice. This webinar is about improving access to specialist advice using eConsult. This session is being recorded for nurses who are unable to participate today. The information and views in this webinar presented by non-CNA staff are those of the presenters and do not necessarily reflect the official opinion of the Canadian Nurses Association. So my name is Ashley Chisholm and I'm a research and policy advisor at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type in the Q&A box that you see to the right of the slide. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenter, Erin Keely. So Dr. Keely is a professor in the Department of Medicine at the University of Ottawa and former chief of endocrinology at the Ottawa Hospital. She is co-founder of the Champlain BASE eConsult service and specialist lead of the Ontario eConsult Centre of Excellence. Her research interests in obstetric medicine, communication between providers, and eConsult have been supported by funding through the Canadian Institutes of Health Research, Diabetes Canada, and the Royal College of Physicians and Surgeons of Canada, resulting in over 150 published papers. So Erin, I will pass it over to you.
Great, thanks very much, Ashley. It's a pleasure to be here to talk about eConsult, which is really transforming the way that specialists and primary care providers are interacting. Before I begin, I'll just talk a little conflict of interest. So I do receive funding from the Ministry of Health as the co-executive director for the eConsult Centre of Excellence. And although I do very few of them now, I have in the past completed eConsults as an endocrinologist. I do not have any vendor relationship. We do not own the technology platform, so there's no financial gain from the eConsult service itself. Next slide. So I'm going to talk about what eConsult is and isn't and its benefits to patients and providers. I'm going to describe the eConsult services available not only through Ontario, but through most other provinces. And then I'm going to highlight some of the roles that nursing is playing in the eConsult services and potential expansion of roles. Next slide, please. So this is myself and Claire Liddy, who's my partner in this. She's a family physician, actually trained as a nurse prior to going into medicine. And this is actually a very personal journey for us. Claire had a patient that she had referred to endocrinology when I was the division head, and she was informed that it was going to take 6 to 9 months for her patients to be seen. She came up to my office. We happened to work in the same campus at the Ottawa Hospital, and we had a cup of coffee, and we both agreed that this was not okay. Both that the patient was going to have to wait, and that I sometimes see patients who wait that long and didn't need to wait, that I could have provided some advice to the primary care provider and they could have carried on with their care. So we decided to do something about it. Next slide, please. As we've gone further down this journey, although we started with wait times, we do know that there are other barriers for patients accessing specialist care, including the availability of the specialist in their own community, appointments and scheduling. I don't see patients outside of usual work hours, although we know many people who are on contracts and when they're not at work aren't getting paid. And so scheduling is a major issue. Transportation, lost wages, acceptability and comfort. So some people are not comfortable seeing a new provider, whether because they have special needs or a medical condition that they don't particularly feel comfortable speaking to someone that they don't know. And they're much more comfortable in their primary care provider's office. Patients with language problems who need to bring a family member or friend with them to translate, although they may have a primary care provider who speaks their language. Patients with dementia or intellectual delay often can't participate in the appointment even if they can receive one. And then we see lots of patients in the Ottawa Hospital, a tertiary care hospital, lots of comorbidities, seriously unwell patients who have multiple appointments with multiple specialists, and even reducing a little bit of that appointment burden can make a difference to that person. Next slide, please. So what is eConsult? So eConsult enables a physician or a nurse practitioner to engage in a secure electronic dialogue with specialists so that they can manage the care, often without the need for the patient actually to have the specialist visit. So this is provider to provider secure communication. What are some of the benefits? Well, it's faster access, and I'll highlight some of that. Avoiding those unnecessary in-person specialist visits, improved care coordination by improving communication, more flexibility and coordination and documentation compared to the phone call, pages, or hallway conversations we often have. We've also realized that it helps build relationships and collegiality between primary care and specialists by opening up that communication, and prompts learning both for primary care and specialists because of that back and forth conversation. It prompts people to go and look things up and to share that learning with others. Next slide, please. So how does eConsult work? Well, the primary care provider is given a registration, secure password, and able to log on to a web page. So most in Canada are web-based currently, although there are some other alternatives. But both are in our region and across Ontario, it's a web page that they log into. The form is very simple, so it's a 4-field form. They select a specialty group from the list on the right, and then it's assigned by a case assigner to an individual specialist. The response should be received within 7 days, although I'll show you data that suggests it's much faster than that. And there can be back and forth communication between the primary care provider and specialists. When the primary care provider is satisfied, they close the case and complete the survey. On the right-hand side, you'll see, oops, sorry, I just had to go back. On the right-hand side, you'll see the different specialty groups that are listed, and then there's subspecialties. So you can see under pediatrics, there are multiple subspecialties of pediatrics. The specialist does have the option of not answering the question, so they have entered a duty of care with the primary care provider and patient. And if they don't feel they can provide reasonable advice with the information provided, they can either ask for information or say that the patient needs to be seen, that they can't offer advice through an eConsult. Next slide. So this video where I'm not going to show, but the link is there for those who want to look. This is a video by the Newfoundland group who paralleled our service, and really is a nice overview of the benefits from the provider and patient point of view. Next slide, please. So just to highlight some of the confusion out there. So there are a lot of things going on in healthcare that many of you may be involved with. This includes e-visits, telemedicine, and e-referral. In general, an e-visit and telemedicine involve the patient. So it's patient to provider communication facilitated by digital assets. So an e-visit is usually the patient and the provider linking through either Skype or email. Telemedicine, the patient is in front of a camera generally, and there's a booked time for that exchange to happen with the specialist at one end and the patient, and often with nursing support or another provider with the patient at the other end of the camera. And e-referrals, I'll just go to the next slide. Next slide, please. Yeah. So e-referrals can include an eConsult, but you may be involved in e-referral systems where all referrals are sent to a central location, and then they are then triaged by urgency, completeness, appropriateness. And some may be deflected to an eConsult where the specialist would answer by an eConsult as opposed to booking the patient. And sometimes it's more pre-consult exchange, so there can be back and forth communication between the specialist and the referring provider until the patient is able to be seen. And I know that some of the triaging role is completed by nurses who have a a major responsibility and commitment to ensuring that the patients that need the appointment are assessed by urgency and communication back to the specialist. Next slide, please. So I just wanted to highlight a couple of cases that have been submitted by nurse practitioners. So nurse practitioners make up about 15% of all primary care providers using the Ontario eConsult service. So we have many examples of cases sent by nurse practitioners. So the nurse practitioner saw the patient with type 2 diabetes, and the blood test revealed an abnormal white blood cell count as revealed by other abnormalities. They provided the medical history, listed the medication, and asked the hematologist if the patient required further investigation or treatment. The hematologist suggested retesting in 3 months, and if the white count remained high, to test for myeloproliferative neoplasms, and usually would provide some background on how to test for those. And you can see by day 5, the nurse practitioner accepted the advice and closed the case. Next slide, please. So what's the evidence that this type of system works for patients, for providers, and for the system? Well, the model that we use for evaluating is called the quadruple aim. Some of you may have heard about the triple aim for quality healthcare improvement, which includes population health, so targeting the population's health outcomes, cost savings, so new initiatives should be cost effective, and the patient experience, so the patient perceived quality and safety. So those 3 have historically been called the triple aim. The quadruple aim adds the provider experience, so provider engagement and satisfaction. And this is especially important for digital health initiatives, as we know that technology is a major contributor to burnout among health professionals, and we're all struggling with how to incorporate technology into our practice. Next slide, please. So what's the evidence? Well, from a better population health, the reach, as I mentioned earlier when talking about barriers to specialist appointments, eConsult, the patient is able to get the advice even though they can't go to an appointment. So those unable to go, such as special needs, dementia, and lack of transportation, and those in very remote communities. So this was a quote from a primary care provider. I have patients who are special needs, and eConsult dramatically improved the level of care I can provide, because many times just getting those clients to an appointment is difficult, or they won't cooperate with a new person. So the eConsult has been excellent and allowed the patients to get access to the care they deserve. We found that a very powerful quote. Although specialists are supposed to respond within 7 days, it's quite remarkable that even as the numbers have gone up dramatically, the median response time is still less than a day, and the mean is between 2 and 3 days. So most of the time, the primary care providers are getting the answer back very, very quickly. Next slide, please. So what about nurse practitioners? So the Champlain BASE service is what we are running in the Ottawa region. So we've been, the Champlain BASE eConsult service has been running since 2010. Started out as a very small proof of concept, and now includes, about 60% of all primary care providers. So of the cases that were submitted in the past calendar year, so January to December 2018, 1,700 of those cases were sent by nurse practitioners. We have 270 nurse practitioners registered, and 141 of those registered have submitted a case in the last year. Next slide. So who do nurse practitioners reach out to? What specialists? Well, it's very similar to what family physicians, who they use. So dermatology continues to be our most accessed group. Then hematology, endocrinology, gynecology, which actually always surprised me how often gynecology is used. Pediatric dermatology, neurology, cardiology, but you can see across the pie that even those smaller numbers, even 1% of 1,700 cases, means 17 people that nurse practitioners were seeing for those diagnoses used eConsult. So even a small piece of the pie represents a large number of people. Next slide, please. We ask on that closeout survey for all providers who submit an eConsult, 4 questions. 2 of them really are about whether it changed the behavior that the provider was going to take. So which of the following best describes the outcome of this eConsult for your patient? The 32% is that it confirmed the course of action the nurse practitioner was already going to take, whereas 65% it was for a new or additional course of action. So that means in 65% of those 1,700 cases submitted, the nurse practitioner is now going to do something different than she was going to do before having the advice through the eConsult. On the right-hand side, from a change in referral pattern, so the 38% of people, a referral was originally contemplated but now avoided. So 38% of those 1,700 people were going to be on someone's wait list, waiting and waiting for an appointment and no longer need to. And that's very consistent. So that number always holds around 40%. The dark blue bar at 4% is that the referral was not originally contemplated, but the eConsult process resulted in one being initiated. So that meant that the nurse practitioner felt they didn't need to refer the patient, but because of the advice they received, they're now going to refer the patient. And we think that's very important for patient safety because those patients would have had a delayed referral or perhaps no referral at all. Next slide, please. So what about equitable access? Well, it doesn't matter where you live, the response time is the same of 2 days. And for those patients, this is a repeat of the quote for those in complex situations, and also in some difficult, vulnerable populations such as chronic pain, addictions, mental health services, the transgender population, HIV population, we feel that we're improving access equitably for no matter where you live or what condition you have. Next slide, please. What about patients? So what do patients think of eConsult? So we've done this a couple of different ways. We've asked patients who had to wait for an appointment in endocrinology if they thought their condition could have been answered through eConsult. And then we've asked patients for whom an eConsult was actually submitted on their behalf and what they thought of the process. The bottom line is patients think it's great. They can't understand why it's not already being done everywhere. So 100% thinks it's an acceptable way to access specialist care. 87% thought it was useful in their case. These are people who received an eConsult. And 83% thought they would use it again if they had a condition they were waiting to see a specialist for. A quote from the patients, "If I wanted to see them face-to-face, it would have possibly taken months. Our doctor, he's a general practitioner, and if he needs advice, it's just a click away. She took photos of both my hands and sent them through the eConsult, and within 24 hours, I was back in the office with an answer." So great confidence from patients that this is a service that's useful and that is valuable to them. Next slide, please. What do primary care providers think about eConsult? Well, 94% of them rate it as high or very high value, and we get lots of positive feedback through the survey, including the comment that's there. Once again, great service. I can't imagine not having the service now and in the future. And so key benefits that primary care providers find: the quick response time, the high quality advice, and the educational value. So again, that sharing of pearls. Thank you for the excellent teaching point. Not only prevented an unnecessary consult for this patient, but it also gave me a teaching point to care for other patients with a right bundle branch block. Next slide, please. So nurse practitioners, like family physicians, are also very positive about eConsult. Gave very useful information to guide my next appointment with this patient. A great timely service, saved the client a trip out of the community. Helpful in guiding immediate next steps for this patient, provided a great learning experience. My plan was to reassure the family that no action is required, and I think that advice will have much more weight since it's backed by a specialist. So we have seen that it's had patients have more confidence in their primary care provider because they know that they've reached out to a specialist and everyone is on the same page. Next slide, please. These are just a couple of other highlights of the educational value for eConsult. We're actually using eConsults now to drive our CME planning. So when we are planning an event for primary care providers, we'll often ask the specialists who have been answering eConsults to provide input as to what the top questions they're getting are, so we can be sure we cover those in CME events. Next slide, please. So what about cost? Well, we pay the specialists prorated. They self-report how long it took them to complete the case. And based on that, the average cost per case was $47, and it's really remained that since we started. And that's lower than it is, of course, for a traditional referral. But there's also all the other costs, such as the patient's travel time, the family member who needs to come, the cost, the lost wages. We haven't yet delved down into as much for the avoided visits, the avoided tests and the avoided visits following the eConsult, but we do think there's cost benefit there. So the evidence that supports eConsult really is across the quadruple aim. So all aspects have shown to be benefited by eConsult services. Next slide, please. So what about the programs that are available? Well, the Ontario eConsult program is being led by Claire and I at the Ontario eConsult Centre of Excellence. And this really developed after a several-year pilot project working with Ontario MD, the Ontario Telemedicine Network, and ourselves at a slow expansion, controlled growth, if you will, of eConsult. And then in 2018, the province funded a full provincial program. We have 4 services in Ontario. So the Ontario eConsult service, which is the primary eConsult service, is through the OTN hub, and it is province-wide. So any primary care provider, nurse practitioner, and family physician has access through the OTN hub. Our original service, the Champlain BASE service, continues. It's on a different platform called SharePoint, and it really is for our region and Mississauga-Halton primarily. Teledermatology is a long-standing OTN platform for teledermatology. It uses a different platform, but very similar idea, and many of the dermatologists participate in both. And then teleophthalmology is a unique service where it actually is fundal photographs for screening for diabetic retinopathy, but it continues and is incorporated as part of the program. We launched a new platform on the OTN Hub effective June 2018, and really what that did is it allowed primary care providers to access a specialist either individually. I want Dr. Keely and I'm going to send this eConsult to her because she's on eConsult, or I need someone in endocrinology to answer this question. I don't know any of the endocrinologists, I just want this answered. And you can go through a managed group or a specialty group as opposed to an individual specialist. Next slide, please. These are the partner organizations in Ontario, and just to highlight, it takes collaboration across many sectors and many organizations to make this happen. And we're very grateful for the input and leadership from our other organizations. Next slide, please. So this is the OTN platform. It looks very similar to the one that I showed you for the Champlain BASE. You'll see again on the right-hand side that long list of specialty services. Above that, where you see base managed specialty, so that provides you the list of all the groups of specialists we have. You just need to select a group, and then it's assigned to an individual specialist within that group. You know who that specialist is. Their name appears in the response. Or if you know of a specific provider or group you want, you can access it through the other button. Next slide, please. I think I've spoken to that. Next slide, please. So these are there's actually now 85. So we just launched the new platform in June, and there are already 85 different specialty groups available across Ontario. And really every specialty you could want is there. So we've been very fortunate that specialists have stepped up and populated all of the groups that we need. We determine the first groups by our own experience of what groups primary care providers want. And then together we're responsive to requests. So in particular, transgender came as a request to us to include right off the bat in the provincial group. So it was one of the first ones that we sought specialists out to be able to provide that service. But overall, we've really been very happy with the breadth of specialty services available. And generally in each of these specialty services, we may have 2 to 6 specialists who answer the questions. So we by no means need all specialists. We just need a few to be able to answer the questions across the province. We are working with regions to have their own communities of practice, their own specialists participate. And we think that is important as well. But we did want equitable access across the province, so everyone in the province has access to this full slate of specialty groups. Next slide, please. Next slide, please. So this is, oops, just go back. This is just what it looks like if you want an individual provider. You can access them by name. So what's happened in Ontario for the last 12 months? Well, there's been 43,000. So our target this year was 50,000. We were a little slowed down with the change in government. We will have 45,000 people in Ontario this fiscal year receive an eConsult. We have over 2,000 active primary care providers and over 600 active specialists. The cost per case remains at $50, and the median response time, despite the increase in volume, remains at 1 day. Again, remembering that the expectation is 7 days. Next slide, please. So what about national spread for those of you who aren't in Ontario? Well, I'm really delighted to say that every province except Nova Scotia and PEI are actively pursuing eConsult, and we just had a webinar with Nova Scotia leadership yesterday, and there's a very high likelihood that Nova Scotia will soon be able to at least have a demonstration pilot project for eConsult service. So we've been delighted to see the spread across Canada, and different provinces have taken a slightly different route, different platforms to what we've taken, but all have been very successful in their launch. Nunavut, we in Ottawa have a relationship with Nunavut for sending specialists up there. So they're accessing our specialists through the Champlain BASE, our regional model. Next slide, please. So just a brief highlight, just in case people wanted to reach out to the leaders within the different provinces. So British Columbia has always been a leader in telephone access. So the RACE line is a telephone access line to specialists, and they've developed a parallel eConsult program called eCase, which really complements the RACE line beautifully. So the more urgent ones can be managed through RACE and the less urgent through the eCase. Next slide, please. Alberta has their e-referral system through Netcare. They use the Orion Health platform, so a different platform than us. They launched in 2014 and have been also had a telephone consult line as well. So they're a true e-referral with building in eConsult as part of that system. Next slide, please. Manitoba used our Champlain BASE model and platform. So they have and they've got multiple partners that started actually through an HIV grant to enable them to pilot an eConsult platform. And we hope to see them continue to grow. Next slide, please. Quebec used our same workflows base, but have their own platform and have developed eConsult pilots in 3 regions, which has recently been endorsed by the provincial government and sustained funding for them. So we're, the Quebec is doing very, very well at expanding their eConsult program. Next slide. New Brunswick, through the CFH, I should just mention the Canadian Foundation for Healthcare Improvement really was the lead organization in getting these other provinces together to follow the base model for eConsult. And all of the other ones I've spoken to did have funding through CFHI, as does eConsult New Brunswick. So they launched a new platform that was integrated into their electronic health record, and it's been going very well recently. Next slide, please. And then Newfoundland has had over 2,000 eConsults done, so they were really our first other provincial partner in getting an eConsult service running. They were using our platform as a parallel service, but are just in the throes of developing their own provincial platform, and will migrate over to that at some point. Next slide, please. So that really is a summary. No matter where you are, except in a few locations, eConsult services are being developed or are developed, each with different funding models and some with different technology, but the same idea of improving equitable access to specialist advice. So what about the nursing role in eConsult? I've spent some time talking about nurse practitioners and asking questions and the types of questions they ask. But there are other roles that I just wanted to highlight. So the referring provider is the nurse practitioner role, but there are, and I can't even begin to speak for all the roles, of course, that nursing does, but in this context, from an eConsult, as a delegate, which I'll talk about a bit more, as an advocate for patients trying to access specialist advice and helping their primary care colleagues use eConsult. And then we do have some examples where nursing is actually the specialist providing the advice for primary care. We also see all types of practice that nurses are involved with, potentially having benefit from eConsult. Obviously, those of you who work in a primary care practice, but also in specialized clinics, so you may be involved in that centralized triage of e-referral or developing new referral pathways, and having eConsult embedded in that may be useful. Community programs, in particular, I'm thinking of mental health and some more vulnerable communities. Certainly the community care access centers in Ontario have been using eConsult, especially we've seen in some for the homeless population, because it's outside the fee schedule, we don't actually need an OHIP number. So as long as they would be eligible for OHIP, they're able to send an eConsult even if there's no OHIP number. We're having an initiative in long-term care, which I'll talk about in a bit. And we're working with both Corrections Canada and the Ontario Provincial Corrections to implement eConsult in corrections. And because of the transportation issues and the cost involved in transporting inmates, it's been perceived as a potential real cost savings. Next slide, please. So what about as a requesting provider? Well, currently it's limited to nurse practitioners. We're looking at other models that we could incorporate, especially in northern communities, where the nurse in the nursing station may actually be the one providing care. One of the key things is the ability to ask a succinct question with relevant information provided. So the person who's submitting the eConsult needs to be able to filter the information and send the information to the specialist in a way that's going to enable them to answer the question that you have. So you want to be able to attach lab results, but not necessarily the full patient EMR. You want to be able to attach photos and then put them into context in the question that you ask. You also need to be able to enact the advice that you receive. So that's one of our challenges when we look at broadening it out to other nursing roles, is that the advice you receive, you need to be able to act on that within your scope of practice. So the expectation is the person who has submitted the eConsult will be able to interpret and act on the advice received. And so that's one of the things that always comes up in discussion when we're looking at other professions and other ways of using eConsult. Next slide, please. As a delegate, really what we're trying to do with the delegate model is emulate the face-to-face referral model. So if there is a nursing role in how patients are referred to specialists for a face-to-face visit, then we can mirror that with that same role in eConsult. So as a delegate, you're working on behalf of other providers to either retrieve a new eConsult request, so submitting the case on behalf of someone, getting notified when the specialist has responded and that specialist response is waiting for action, to access the response, to add it to the patient chart, to notify the primary care provider that new information is there. So if you think of how you work in your usual environment and if there is a role within that referral consult face-to-face process, then perhaps there's also a role that could be used for leveraging eConsult and promoting eConsult use. We're really big fans of the delegate model in large groups, so especially in family health teams. In corrections, there's very much a nursing role in the referral consult process, long-term care as well. And then, as I mentioned, in remote communities, where it really is the nurse who's leading all of that. Next slide, please. So this is just the OTN platform, and a delegate is given permission and is set up with those providers that are within her circle of care. So you're a delegate only for those providers for which you have a relationship with, and it's documented which provider you're submitting on behalf of. Next slide, please. Next slide, please. So what about as an advocate? So really, to me, as an advocate, you would encourage the use of eConsult in your work environment to improve access for your patients, especially those living in complex circumstances. This is really highlighting the long-term care initiative that we have. So we're currently working with 32 long-term care homes in Ontario who have been introduced to eConsult. And we're working with the physicians, the nurse practitioners, as well as the nurses in the homes to look at how we can enable eConsult to be used for patients who really would otherwise have no access because of comorbidities or inability to transport to the specialist visit. And certainly this is of keen interest to government as well as to long-term care home providers and organizations. Next slide, please. As a specialist, so there is opportunity for non-physician specialists, but it really depends on the remuneration and terms of service of that eConsult service. So it's different in different provinces, and it's even different in Ontario. On our service, the Champlain BASE service, we've had several non-physician specialty groups for several years. We're able to pay them outside of Ministry of Health funding from research funding. So for instance, we have pharmacists both for general pharmacy and for specific groups for geriatrics and HIV, for example. The HIV pharmacist is already on a salary through the hospital, so does not receive any additional funding. It's considered part of their scope of work. Social work for HIV, similar. We have the RN is the nurse specialist for bariatric care, for the sexual assault and domestic violence, and for the Parkinson's Care Network. And the provincial-wide, the OTN service, we don't yet have that flexibility, but we're certainly have many who are interested in looking at an expanded specialist role and are working through some of the details and trying to figure out ways to make that work, because clearly we see benefit in non-physician specialists for primary care providers, people they need to reach out to and are important for the care of their patients. Next slide, please. So that's a summary really of eConsult, what the purpose of eConsult is, what the benefits of eConsult are that we've seen to date, what the national landscape is, and I should say that the College of Family Physicians and the Royal College of Physicians and Surgeons of Canada have all endorsed eConsult as a standard of practice, so this will continue to flourish in environments that you'll work in. If you're interested in signing up and are a nurse practitioner in Ontario, you just need to reach out to us and we will get you an account and get you set up. If you want to learn more about the delegate feature or how to possibly incorporate this within your own practice in Ontario, the same email, that's the eConsult Centre of Excellence email. If you want to connect with leaders in other provinces, I'm happy to make that virtual connection for you. Or if you have any general questions or feedback or concerns, I'm happy to hear from you as well. I'll hand it back over to you, Ashley.
Okay, so thank you, Erin, for your presentation. It's always so fascinating to hear how much eConsult has grown from the cup of coffee that you and Dr. Liddy initially had to the strong evidence base that was shown throughout the presentation, and how eConsult is ultimately improving the healthcare system and providers and patients in many jurisdictions in Canada. So we are going to, we've had a couple of questions roll in throughout the webinar. So I will take this time now to ask you a couple of questions.
Sure.
So this one is, I am a nurse who works in a family health team. Am I able to submit an eConsult in Ontario?
So nurse practitioners or nurses are not yet able to, and it really comes into that scope of practice. So you can't independently submit an eConsult yet, but you can submit one on behalf of your physician or nurse practitioner that you work with in the clinic. So that would be the delegate model, where you would be submitting the eConsult on their behalf. Excuse. So that's the current limitations within the Ontario system.
Thanks. And another question is, I work with patients who often can't go for a specialist appointment. Is it still okay to send an eConsult if they aren't likely to go for a formal visit?
Yes, so eConsult, the requirements for submitting an eConsult for a patient is not that they would go to a specialist appointment if needed. So it is completely okay to submit an eConsult for a patient that you know would not be able to go to a specialist appointment. In fact, you may get the eConsult answer from a specialist outside your community, from another part of Ontario or other provinces. Really, the goal is providing some advice back to you about the patient and next steps. If the advice is that the patient needs a face-to-face visit, then it really is still up to the primary care provider, patient, and often families as to whether to follow through with that or not. So by no means does it, even if you get back the advice that the patient should be seen, by no means does that commit you or the patient to actually have a face-to-face visit. It really remains within your judgment and the patient's wishes. The same thing should be if the response back is that the patient does not need a face-to-face visit, that doesn't preclude you from sending the patient for a face-to-face visit, should you or the patient still think that would be the better thing.
Okay. So if you have any additional questions, please feel free to contact Dr. Keely or myself at the email addresses on the screen. Thank you again, Dr. Keely, for your presentation, and we hope this session stimulated your thinking about services for eConsult.
Thank you very much, Ashley, for inviting me.
Oh, thanks for coming. So you can access the recording of our webinars by visiting CNA's YouTube channel. You can also download files and your certificate of participation now by using your pods under the presentation. If you haven't already, please consider registering for the next webinar, Strengthening Public Health Nursing Leadership for Systems Transformation, which will be held on Tuesday, April 23rd from 12 to 1 p.m. Eastern Time. Thank you for your participation today. Bye.